Protect your nights after 65. 12 hidden habits putting your life at risk. Aging gracefully means protecting our bodies even while we rest. Unfortunately, certain common habits can transform a peaceful night's sleep into a hidden risk, especially for adults over 65. Drawing on research from leading U.S. health organizations and expert consensus, this comprehensive guide reveals 12 scientifically validated behaviors that dramatically increase the likelihood of fatal events during sleep. By recognizing and correcting these habits, you can safeguard yourself or your loved ones and turn each night into a truly restorative experience. Part 1. Untreated obstructive sleep apnea. The hidden chokehold. Obstructive sleep apnea, OSA, occurs when soft tissues in the throat collapse, repeatedly blocking the airway. In seniors, unrecognized OSA causes chronic low oxygen levels, surges in blood pressure, and dangerous arrhythmias, especially at night. A landmark New England Journal of Medicine trial found that untreated moderate to severe OSA doubles all-cause mortality in older adults. Why over 65 are at heightened risk? Muscle tone diminishes with age, making airway collapse more likely. Coexisting cardiovascular disease amplifies consequences of nocturnal hypoxia. Expert guidance. Watch for loud, chronic snoring, witnessed breathing pauses, daytime fatigue. Ask your physician about at-home pulse oximetry or an in-lab sleep study. Continuous positive airway pressure, CPAP, therapy cuts OSA-related mortality in half. Part 2. Overuse of sedative hypnotic medications. When help sleeping becomes harmful. Benzodiazepines, e.g., diazepam, and Z drugs, e.g., zolpidem, are often prescribed to seniors for insomnia. Yet these medications blunt respiratory drive and worsen sleep-disordered breathing. The American Academy of Sleep Medicine warns that chronic use in older adults quadruples the risk of fatal respiratory depression and doctor-reported overdose incidents. Age-related vulnerabilities. Slower drug metabolism leads to higher nighttime blood levels. Polypharmacy interactions further depress heart and lung function. Safeguards. Prioritize cognitive behavioral therapy for insomnia, CBTI, over medications. If medication is necessary, use the lowest effective dose for the shortest duration. Regularly review prescriptions with a geriatric pharmacist. Part 3. Heavy alcohol consumption before bed. From nightcap to nighttime hazard. Many seniors enjoy an evening drink to relax. Alcohol, however, profoundly relaxes throat muscles, worsening or even precipitating OSA events, and disrupts the arousal response that prevents fatal pauses in breathing. A chest journal analysis linked pre-bedtime drinking to a 37% increase in nocturnal cardiac events among older adults. Why seniors are particularly susceptible. Declining liver function slows alcohol clearance. Combined effects with other medications heighten respiratory depression. Practical advice. Limit to 1 standard drink per day and finish at least 3 hours before bedtime. Substitute with non-alcoholic relaxation rituals, herbal tea, reading, gentle stretching. Part 4. Polypharmacy without regular review. A dangerous cocktail. Taking 5 or more daily medications common among seniors increases the risk of harmful interactions, especially at night when multiple drugs can synergistically depress breathing or blood pressure. The American Geriatrics Society reports a 25% higher incidence of overnight fatal drug reactions in polypharmacy patients. Key vulnerabilities. Sedatives plus opioids plus antihistamines equals compounded respiratory suppression. Blood pressure medications plus diuretics equals nocturnal hypotension and falls. Steps to protect. Schedule a brown bag medication review every 6 months with a geriatric specialist. Discontinue unnecessary prescriptions and adjust dosing times to daytime when possible. Part 5. Skipping treatment for atrial fibrillation. Silent rhythm threat. Atrial fibrillation, AF, affects over 10% of adults above 65 and often worsens at night. Irregular atrial contractions can trigger stroke or sudden cardiac death during sleep. A study in the Journal of the American College of Cardiology found that untreated AF nearly doubles overnight mortality in seniors. Age-related challenges. Age-related fibrosis of heart tissue raises AF incidence. Nocturnal bradycardia or pauses increase risk of fatal arrhythmias. Preventive measures. Report palpitations, dizziness, or chest fluttering to your cardiologist promptly. Utilize ambulatory ECG monitoring, e.g., Holter, wearable patches. Ensure anticoagulation and rate control therapies are appropriately dosed. Part 6. Uncontrolled diabetes and nocturnal hypoglycemia. When blood sugar goes too low. Seniors on insulin or sulfonylureas risk nighttime hypoglycemia, which can provoke seizures, arrhythmias, or respiratory arrest. The American Diabetes Association warns that recurrent nocturnal lows triple mortality risk in the elderly diabetic population. Contributing factors. Reduced hunger cues and long overnight fasts. Impaired counter-regulatory hormone responses with age. Safety strategies. Employ continuous glucose monitoring, CGM, with alarms set for low thresholds. Adjust long-acting insulin dosages under endocrinologist supervision. Have a bedtime snack pairing complex carbs and protein when recommended. Part 7. Overheated or poorly ventilated bedrooms. Heat, an overlooked cardiac stressor. Sleeping in a room above 77 degrees Fahrenheit or with inadequate airflow forces the body to work harder to cool itself, stressing heart rate and blood pressure. Harvard researchers linked high bedroom temperatures to a 23% rise in overnight cardiovascular mortality among older adults. Why it matters for seniors. Impaired thermal regulation reduces heat dissipation. Common comorbidities, e.g., heart failure, magnify heat stress effects. Home adjustments. Maintain bedroom temperature between 60 to 67 degrees Fahrenheit using thermostats or fans. Ensure proper ventilation or use a mild nighttime fan to circulate air. Part 8. Neglecting severe COPD or asthma care. When the lungs don't rest. Chronic obstructive pulmonary disease, COPD, and nighttime asthma can trigger fatal respiratory failure if uncontrolled. The American Lung Association highlights that seniors with poorly managed COPD have a 40% higher rate of fatal nocturnal exacerbations. Age-related vulnerabilities. Declining lung elasticity impairs gas exchange. Reduced cough reflex slows airway clearance. Recommended actions. Strict adherence to inhaled bronchodilators and steroids as prescribed. For advanced cases, discuss overnight supplemental oxygen therapy. Part 9. Eating heavy, high-fat meals before bed. From reflux to respiratory distress. Late-night feasts, especially high-fat or spicy foods, can provoke reflux-induced laryngospasm, asthma exacerbations, and choking risks. A gastroenterologist study found evening reflux events increased sudden death odds by 18% in seniors. Why seniors are at risk? Slowed gastric emptying prolongs acid exposure. Age-related esophageal motility issues worsen reflux. Healthy dinner habits. Finish meals at least 3 to 4 hours before bedtime. Elevate the head of the bed by June 8 inches to reduce reflux episodes. Part 10. Late-day smoking or vaping. Nicotine's nighttime assault. Nicotine raises heart rate, constricts vessels, and spikes blood pressure, setting the stage for nocturnal hypertension and arrhythmias. The CDC reports that seniors smoking within 2 hours of sleep face double the risk of fatal cardiac events. Unique senior risks. Slower nicotine metabolism keeps stimulatory effects overnight. Combined impact with other cardiovascular medications. Cessation tips. Aim to quit entirely. If not, avoid any nicotine after mid-afternoon. Seek support from a certified tobacco treatment specialist. Part 11. Nighttime use of over-the-counter decongestants. Nasal relief with deadly cost. Pseudoephedrine and phenylephrine in cold medications constrict blood vessels to relieve congestion, but they also increase blood pressure and stroke risk. A stroke journal review linked evening decongestant use in seniors to a 30% rise in morning stroke incidence. Age-related dangers. Reduced drug clearance heightens daytime and nighttime blood pressure spikes. Frequent polypharmacy interactions. Safer alternatives. Use saline nasal sprays or adhesive nasal strips for mechanical relief. Reserve oral decongestants for daytime use only, under physician guidance. Part 12. Ignoring seizure disorders and severe neuropathy. When the night becomes dangerous. Uncontrolled epilepsy carries a heightened risk of sudden unexpected death in epilepsy, SUDEP, which peaks during sleep in older adults. Likewise, severe diabetic neuropathy can cause pain so intense that it triggers respiratory irregularities or falls from bed. Senior-specific concerns. Age-related neuronal changes exacerbate seizure thresholds. Impaired sensation increases fall and choking risks. Critical precautions. Strict adherence to anticonvulsant regimens and regular neurologist follow-up. Employ bed alarms, roll bars, or motion sensors for those at high SUDEP risk. Invest in pressure relief mattresses to reduce neuropathic pain flares. Conclusion: nighttime vigilance for lifelong safety. A restful night's sleep is vital for healing, memory consolidation, and emotional resilience. Yet for those over 65, seemingly benign habits can become life-threatening in the dark. By identifying and modifying these 12 high-risk behaviors guided by evidence from the New England Journal of Medicine, American Academy of Sleep Medicine, CDC, and other U.S. authorities, you can reclaim nighttime safety and ensure each dawn greets you in good health. Next steps. 1. Assess risk. Review this list and identify which habits apply to you or your loved ones. 2. Consult professional. Discuss concerns with your primary care physician, pulmonologist, or geriatric specialist. 3. Implement changes. Gradually phase out high-risk behaviors, replacing them with safe alternatives. 4. Monitor progress. Schedule follow-up sleep studies, medication reviews, and cardiac check UPS. Your body has carried you through decades of life's journey, now let it rest safely. Nighttime vigilance isn't about fear, it's about compassionate care and evidence-based action.